Let's be honest, we all lose little hair in the shower, but when your scalp starts showing, that's when the panic sets in. Today on the doctor's couch, we are diving into hair loss, why it happens, what you can do to prevent it, and the treatments that actually work. From modern medicine to ancient remedies, whether you are male, female, or somewhere in between, this one is for you. What causes hair loss? Hair loss, medically called alopecia, can be temporary or permanent. It affects both men and women in different patterns. According to American Academy of Dermatology, we lose about 50 to 100 hairs a day. That's normal. But when hair loss becomes excessive, it's time to investigate. Here are some common causes. Number one, genetics, also called as male or female pattern balance, androgenic alopecia. Stress and trauma, physical or emotional stress, can trigger sudden shedding. Hormonal changes like pregnancy, menopause, thyroid dysfunction, nutritional deficiencies of iron, vitamin D, protein, and B12, medical conditions like autoimmune disorders, PCOS, thyroid disease, medications which includes chemo, blood pressure medications, and antidepressants, hairstyles and treatments like tight braids, chemical relaxers, and hair styling. So before grabbing that miracle oil off of social media, check in with your doctor. Early awareness makes a big difference. Let's talk over the counter treatment options. There are two FDA approved treatments that have some science behind them. Number one is Minoxidil, also called as Rogaine, widely available, work both for men and women. It increases blood flow into the hair follicles, needs consistent long term use, or the hair loss resumes. Possible side effects can be itching, irritation, and facial hair growth in women. Finasteride, also called as Propecia, is a prescription pill for men. It blocks DHE or hormone linked to hair loss. Not approved for women. It may cause sexual side effects in some men. These don't regrow a full head overnight, but they can slow or stop hair loss in many people. What about Ayurvedic or natural remedies? Ayurveda and herbal traditions have often recommended amla, which is Indian gooseberry, vitamin C rich and anti-inflammatory, Bhringraj oil, traditional scalp massage oil, fenugreek and onion juice said to improve follicle strength. Ashwagandha help balance stress hormones. But let's be clear, while these may improve scalp health and circulation, most lack large-scale clinical trial providing effectiveness. That said, if they have been used safely and don't delay in medical care, they may be worth exploring as complementary treatments, not as replacement. Before starting any treatment, get basic blood work to rule out any underlying issues like thyroid issues, TSH, T3, T4, iron levels and ferritin, vitamin D and B12, hormones, especially in women with PCOS or irregular cycles. And remember, sudden or patchy hair loss could signal autoimmune issues like infections or serious illnesses. Always check in with a healthcare provider first. What are other options available? PRP, platelet rich plasma. Your own blood is processed to isolate growth factors, inject in your scalp to stimulate follicles, requires multiple sessions, not always covered by the insurance. Early studies shows promise. The next is low level laser therapy, a home device or in office sessions. It improves circulation to hair follicles. FDA cleared, but results can vary. The last is hair transplant surgery, ideal for genetic baldness, involves moving healthy follicles to thinning areas, permanent but pricey and requires skilled surgeon. Best results when done early. Hair loss isn't just about cosmetic, it's emotional, it's hormonal, and sometimes it's a sign of something deeper. So don't just suffer in silence or follow the TikTok trends blindly. Talk to your doctor, run the labs, start early, and remember, hair loss isn't your fault. This was the doctor's couch. If this helped you or someone you care about, share this episode and help break the silence on hair health. Until next time, I'm Dr. Rahman Mohammed, reminding you the road to wellness sometimes starts with a strand.